So, good day to everyone, and thank you for being here today. Um, um, Sorry, thank you for coming and to end off celebrating Rural Health Awareness Month. Due to COVID-19 protocols last year, we had to postpone Rural Health Awareness Month. But this year we have started it up again. And as in the past, we would host events that students can interact with other advocates for rural healthcare and learn more about rural healthcare in South Africa. This year, we continued this trend virtually. Rural Health Awareness Month is an opportunity to celebrate and bring awareness about the challenges faced by rural communities in South Africa in accessing healthcare and engaging with students and public bodies on what they can do about this. For instance, Run for Rural is aimed at raising awareness of the average distances that people in rural areas have to walk in order to access health facilities throughout South Africa. This differs due to the different densities of the hospitals in certain areas, and in rural areas, the distances um, are much longer because the density of hospitals are fewer. Um, so this shows the inequality in healthcare services throughout South Africa. And on average, um, uh, people living in rural healthcare have to walk more than 10 kilometers to access their nearest healthcare facility. So rural healthcare in South Africa needs awareness because it's so prevalent, and the majority of our country lives in a rural setting. Our health system is part of a cycle that does not always ensure that all of our vulnerable groups are properly advocated for. So it's our responsibility as health professionals to step as and to advocate those who need it. So the events that we've had for this month, we've hosted a string of virtual and contact events where students can engage on the topic of rural healthcare. We started off opening our photography competition, which closes on the 5th of June, so you still have time to enter. This aims on the aim is to focus on what students would miss about the urban setting if they were placed in a rural setting, and aims at bringing awareness of a rural setting. Next, we had the Burns event in collaboration with Shoko Health. Our community development team went to a clinic in Hout Bay and raised awareness amongst parents and their kids about burns for the upcoming winter season. They went to Imizamayetu, a school in Imizamayetu, that the clinic was being hosted at, and the event aimed at focusing on prevention of burns and what the immediate management of burns are. So our community development team interacted with the mothers and fathers at the clinic in order to create awareness of burns. Our events management team also hosted an Intro to Rural Health workshop with guest speakers Lolwake Makube Mabalekwa to speak about their student experiences with RSN rural placements and Shulker Rural. They also hosted an annual internship and ComServe talk with qualified healthcare professionals for students to engage with and ask questions about working in the rural healthcare setting and what their options are after graduating. These talks have also been recorded and will be posted on our YouTube channel. We also our student development team also hosted a raw materials workshop, which was a great success in trying to put together devices with materials around with what you have. And this was focused on all disciplines, which was a great success and was very well done. We also aim to fundraise towards the 2021 RSN placements and towards sponsoring a rural child via the Goed Gedag Trust. In order to fundraise towards this, we hosted Run for Rural 2021 and hosted our first Hike for Rural in collaboration with UCT MSc. On the 23rd of May, we hosted Run for Rural virtually, which turned out to be a great success with 42 entries and hosting a virtual prize giving today. We also hosted Hike for Rural, which was this morning, which turned out to be a great success despite the rainy weather. Sitandiwe, I think I will give it to you now to announce the prizes.
Okay, thanks, Anissa. So before you just hand out the prizes, you just have to thank everyone for everyone who has participated in our events as well as participated in the Run for Rural as well. We really appreciate it. And so now I'm just going to announce the winners. So we have 2 winners for the 10K race and then 2 winners for the 5-kilometer race as well. So the winners for the 10K, they will win a Run for Rural t-shirt, a thermoflask sponsored by Rula Mobile, and a Takealot voucher worth 200 Rand each. And then the prizes for the 5K race will include a scrub top sponsored by Tank, a stationery pack, as well as chocolates. Okay, so the winners for 10K, first place goes to Ilyas Amin, and then second place goes to Adrian Erasmus. And then for the 5-kilometer race, the first place goes to Kuliso Ranzida, and then second place goes to Ronique Erasmus. Congratulations, guys. So if you are on the call, if the winners are on this call, can you please indicate if you are able to fetch the prizes from Faculty of Health Sciences in the upcoming week or not? And if not, we'll be in contact with you to arrange an alternative pickup for you. And please also indicate if you're not in Cape Town as well. And with regards to the sign-up packages as well, we are still in the process of making those. So once they are ready, we'll be in contact with you to collect them from the Faculty of Health Sciences if you're able to do so. Thank you.
So if you could just indicate in the chat whether you're able to fetch the prizes from Faculty of Health Sciences this week. I think Ilyas and Adrian are not on the call. So Ronique and Kuliso, you can. Okay. So now we'll just be hosting a raffle. For in closing of Run for Rural. This is for the people in the school. But the prizes up for grabs are 4 textbooks. So we'll have 8 drawers. It's 4 textbooks and 4 scrub tops, personalized with your names and the logo for UCT. So the 4 textbooks are Family Medicine, Clinical Medicine, Child Health for All, and Medical Science, all sponsored by Oxford. Oxford Publishers of Southern Africa. Okay, Ronique, I acknowledge your message in the chat and also Kuliso. Okay, so, sorry, just hang on. Here we go. Okay, so the first prize winner for a scrub top is Malu McLean. Sita Tiwe, if you could just make note of the prize winners for the scrub top. Okay, so the first scrub top winner is Malu MacLean. The second scrub top winner is Mishka Munasamy. The third scrub top winner is Amani Bagula. And the last one is Tessa Jenkins. Okay.
Hey,
So, hey, Chris.
For the scrub tops, is it possible if they just send what color they would like?
Sure. Okay. They aren't currently in the meeting, so so I will email them and let them know about the scrub tops. So the winners for the scrub tops are Malu MacLean, Mishka Munasamy, Amani Bagula, and Tessa Jenkins. Okay. So now we're going to move on to the first textbook, which is the family medicine one. So that the winner of that is Gabriella Latahan. And then the second textbook is the clinical medicine one. Okay, the winner of that one is, oh wow, myself, Anissa Caspi. The winner of the Child Health for All book is Sanele Molloy. And the winner of the medical sciences book is Kuliso as well. So you can fetch your prizes from Faculty of Health Sciences this week. Please indicate if you are also able to fetch it. I think Gabriella's in the call. Kaliso, you said that you are able to fetch. And then we'll just contact those that aren't here. But yeah, so thank you everyone for coming. And thank you also for participating in Run for Rural. Chris, do you have anything to add?
Just to thank you. Look forward to the more events that are coming, and yeah, I would just like your participation as well. And I think like Run for Rural was, I know, the highest participation number we've had so far in fundraising, and we're hoping for higher numbers as we go. Thanks, guys.
Thanks, Chris. Okay. Gabriella, I acknowledge your message. Okay, so that's all for the virtual prize giving. Thanks so much for coming. And we hope to see you guys at our other events. Thanks, guys.
Thank you.